Good afternoon to all. Welcome to the December 30th Derby Public Schools Gating Committee meeting. Hope those of you that are on winter break, you guys are enjoying yourself. Each committee member should have earlier today received information and data in preparation for the meeting. Since our last gating meeting, I did want to provide the committee updates from the most recent Board of Education meeting, and those are updates to the gating committee criteria chart that supports the recommendation from the Kansas State Department of Education. So those updates, just to provide some highlights for the group, included on the chart with the red area, early childhood through 5th grade, that would be in person, maybe hybrid versus remote. And then in addition, there were a few other updates. It was under the district and school offices that would be limited visitors by appointment, mask and social distancing would follow current guidelines, and building access requirements must be met. In addition, playgrounds would be listed as open, but masks should be worn if not 6 feet apart and for 10-minute period, or it could be closed if needed. And then spectators and audience at events would cover the same CASHA League and Health Department guidelines all the way across the chart. There was also a note that was approved to be added that at any time staffing and student absenteeism may impact the gating criteria and modes of learning at a particular school. So what that does mean is if for some reason we did get into staffing issues or other things, that could be noted, and just because the chart doesn't say that an elementary could be closed, if needed, that could happen. I did also want to address that I think it's important, since the last meeting, some conversation has taken place with Sedgwick County and visiting with Adrian there at Sedgwick County. The question came up about, since Dr. Mins had an order that went through a particular time frame, we did reach out to him and say, based on some of the latest research that's been out there, does that change? If we had okay numbers, would it be okay to run in person? And they did give the okay for that. So I think that's important, as long as we have staffing availability, that that could be considered. So did want to provide that information. Other information important to note as we get ready for today is that for those and families that are tuning in, it's important to note, even though there were changes to and updates to the gating criteria information, that we are going to continue to offer our families each 9 weeks the availability of either choosing in person or the ability to choosing remote. So that piece hasn't changed. It's a 9-week decision for families. And if they choose those options, then that time will roll around. Right now is not a change period. It's important to note. So if people are tuning in, that is going to be later in January. Information will come out, but that is not at this point a change period. So an example would be is elementary, even though that has been changed under red, if a family later felt that they wanted just to go full remote, and when that period comes up, they could make that choice. So those are the updates. I wanted to see if anyone had any questions on any of those before we get into the meeting, then we'll start going over our information. Okay. If not, we'll get right into it with our information and looking at our gating criteria considerations chart. And again, should have received that information. Latona is going to pull up that chart so we can again take a look at the one we're talking about. It's the gating meeting December 30th for January 4th through 15th. And it does have on there the various markings on there. The first one is gating criteria considerations, about 13.05%, but I do want to show it just so the individuals that are looking and joining in can see what we're referring to. These charts and things right there is what we're looking as a reference. Again, committee members, those are linked onto that document, so you guys can take a look at that at your home. With that being said, we're going to start on gating criteria considerations, and I believe, Nikki, you're going to walk us through some of the information. Today, I will mention to the committee members, we are going to be voting on each area. So gating criteria considerations, once we get done sharing information, we will be taking a vote whether we agree with, is it red, orange, yellow, or green? And then same thing, then we get ready for community trend, we would take a vote, green, yellow, orange, or red, and so on. So with that being said, Nikki?
Yep. So this first one, that gating criteria considerations, that comes from the chart from the Sedgwick County Health Department. And the 2 weeks that we are looking at is December 6th through 12th, and then December 13th through 19th. Those two, 13.6 and 12.5, are listed on their chart there. So we have an average of 13.05%. The other part of this that we looked at, or that we kind of take into some consideration, is just the numbers of our district as well, and that our numbers are slowly declining, but I know we will look at those at the next two of them. I don't know if anybody has any questions on that information there.
I did have a question on that. I know in looking at the information, the test results, the number of tests have declined dramatically. So do we feel that information is accurate with the number of tests being down so much?
Well, I don't think we've ever looked at the test and those part of that decreasing. All we've ever looked at is that very bottom line about the percent positive cases.
I guess I'd
We're taking an extra factor consideration for the number of tests given.
Okay. I guess that's mainly directed to the doctors. I'm not sure why they went down so much over, I mean, maybe a factor of the Christmas break, but the number of tests went down dramatically, and I just wasn't sure why that was happening. They were going up, 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 and then all of a sudden they went down. So that seemed strange.
Marty, do you know why that happened? I would think the number of tests that are being run would be going up because more people are seeking testing. Do you have any insight?
Jeff, what number are you looking at? I don't have that in front of me right now. I'm
looking at the last 2 weeks. Week 20 went from 13,449. Week 21 went down to 10,601. And week 22 went down to 6,888. And that's all the way back down to the numbers from 3 months ago.
Yeah, some of that may be, I mean, with all the holidays here, I mean, there's been trouble getting people tested. We've been doing some more, but I'm wondering if it's also an aspect of how well that number's been updated. Because we've been still doing, it seems like quite a few, but overall, it seems like the number of people being sick has gone down some. So maybe that number's gone down too. But some of it, I guess, is on counting over the holidays and whether all that number has been added in yet.
Okay, thank you.
Sure.
Okay. Any other questions from Nikki on that one? Okay. If there's not any questions, so that stays fresh in everybody's mind, Latona will go ahead and put the polling question. Again, looking at that information, we're at 13.05. So looking at whether it's green, yellow, orange, or red. All right, with the results 44 to 56, with that, we would be placing in orange on that one. Okay. With that being said, moving on to community trend. And I think, Nikki, you have information on that?
Yep, I will start with the community trend and then the student trend information. So again, on the Sedgwick County matrix, if you look at that 2-week trend column that they have everything as decreasing or stable. So there's that first piece of information. And then Latona, I don't know if you're able to pull up the student trends for gating chart. Yep, that one. This just has our information per week that we have been tracking. And you can see that the last couple of weeks we have definitely decreased in the week by week. And then Latona, if you scroll down, I also have the gating committee numbers. Most of them are on a 2-week basis there, but this last one is actually the past 5 weeks of data. Go up just a little bit more. Yep, right there. So that one has also decreased quite a bit. So that is the student information. I did also link up there just the last 2-week district dashboards, that week that ended on the 14th and then, or not the 14th, that started on the 14th, ended, and then the week that ended last week as well, just as a reference point. And then I think Becky's got some information on staff.
Yes, thank you, Latona, for can you pull up that stuff? There you go. The staff trends for gating, this is also linked up to your information, but so that everyone viewing can see it as well. If we look at those last 2 weeks, December 14th through December 23rd, we can see there that the positive cases by week are declining. We kind of peaked there in the middle of November through that first week of December. And then if you can click on the stuff in quarantine on Friday, these are our snapshots. And we do have some Wednesday snapshots in there due to the holidays, but you can see that as our staff quarantine numbers go, those are also decreasing.
Okay, questions for Becky? Okay, any questions? I do want to make sure, I did just get a message from somebody that they could not vote. So the previous one, we had not everybody, we knew there were 2 people that didn't, but if we're having issues voting, I don't want that to be a problem for people. So we do want to make sure that it's working for everybody. So we're going to make sure on this one, and then if we need to go back to the other one, I want everybody to be able to vote. So if you don't want to say it out loud, if you can just privately chat over at the side, let us know, but we do want to make sure everybody can vote. So with that, if there's not any other questions, we'll go ahead and we're voting on community trend right now. So she's going to pull that up. That's the second one on there again, community trend. Okay, I'm just doing a last call to make sure this time, if there's any issues with voting, if you guys could please just let me know. Looks like we have 25 out of 26, but the 26, it may be me because I'm not voting. Okay, everybody voted? We're good. All right, looks like we are in yellow on this one. We are going to go back, and I don't want to cause issues since we did have that trouble. If we can go real back up to, since we were so close on the one before, just making sure that we're still in orange, and because we didn't get everybody to vote. So if we can go back up to the previous one, Latona, can you pre-program that again? So relaunching, this is gating criteria considerations. This is the one that we are at 13.05. Okay, I believe we have all of them now. Okay, we are still at orange. Okay, 54. Okay, moving down to community criteria. Nikki?
Yep. So this one, the numbers on the far right, again, those come from the Sedgwick County Health Department. It is the line labeled new community disease cases per 1,000 residents. It's the one that has the clusters taken out. 2 weeks, or the week 20 was 357.3. Week 21 was 259. And so those together is 616. The other information that is linked up under that spot again is the staff and student trends in our district, which we just looked at a moment ago.
Okay, very good, Nikki. And then if our physicians have any input either on community criteria or that they feel they'd like to add at this point. Okay, if not, any questions on that? All right, let's go ahead then and vote on community criteria where you would place overall.
I think Tina had a question.
Just a point of clarification, and I know the answer, but I just want to make sure that everybody else understands it. The numbers that we're getting as far as positives and quarantine, those are not self-reported. Those are coming from the sorry, I almost said Humane Society. Been thinking about New Kitten. Sorry. Those are coming from the health department, correct? Not self-reports.
For the ones on our student and staff trend data?
Yes.
It's actually both. So we do get some self-reports that we then verify with the health department, but if they don't self-report, the health department for students does call us and let us know.
Okay, so we are not relying on people to call. I mean, I understand that we are in some respects, but that is not, we're not just totally relying on people to call and tell us that they have it, correct?
For students, correct, yes.
Thank you.
Yeah.
Yes, they are also notifying us if staff identify themselves with the health department affiliated with Derby Schools, the health department does notify us of those as well. So as Nikki said, it's both directions. We're cross-checking both ways and verifying those self-reports with the health department as positives before we count them.
Okay, very good. Thank you.
Sure.
Those two results seem really polarized. Do our physicians have an idea of why?
I think my answer would be is because the kids have been at home and are obviously doing a good job. Most of the numbers that you're seeing that are high, I would say, are still either people that were out traveling or not being as cautious, or people that were working. So my take on these numbers is that at the school they look great, and so I think it's time to get the kids back in school based off of those numbers. I haven't seen these get a number since we started this. So, I'm excited to see those numbers actually. Are they going to go up after, the New Year's and stuff? probably a little bit, but they really haven't, gone as bad as what I thought they would. And so, these are good numbers to look at, but I think a lot of it does have to do with, who's getting tested, not getting tested. And with the kids being at home, we were able to, knock this down and, get it back where we wanted it. We did exactly what we wanted to do at these 3 weeks of having them at home. So it worked. Now we can get them back. But it does bring a question on this vote that we're doing. Is this a vote based off of our students or based off of the community? Are we supposed to vote off of the green that's there or off of the red that's there? Because you're right, there are polars.
I appreciate you clarifying. At a previous board meeting, and feel free, we have 3 board members that are on the call, that we had talked about that our data, meaning it would be voting more heavily looking at what is happening in our district, so the student and staff trend versus what's happening everywhere else. We wanted to have a picture so you guys can see, hey, this is still going on, but the direction is the vote is would weigh heavier, keeping in mind that students and staff would be in the green. And feel free to chime in, Ms. Folkerts, Mr. Watkins, or Ms. Pernier if you have anything else to add on that, but that's the direction from the board. Okay.
Hey, Heather.
Yes.
Andy Watkins. Hey, yeah, I would agree with that. The only other thing I would point out as to the question as kind of the differences between those numbers is when you're looking at that, you got to consider that those are the numbers per 100,000 people. And so, we're also looking at our numbers per 7,000 students, 1,200 employees. So there's a little bit difference in kind of how you slice it. So just to point that out, the trends are decreasing, but the benchmark that was used was, I would say, pretty stringent for the county. And so we are higher than that. So there are other states that have had higher benchmarks for this per 100,000 number as well, just for information.
Okay. Any other comments or questions before we vote? Okay, if not, it is live there. Again, community criteria where you would place us. Just want to make sure everybody votes. We have 20, we're missing 1 person right now.
My screen won't show up.
It's not popping up for me either.
Yeah, I don't have it popped up.
Okay, she's going to relaunch it, so everybody will need to vote again just to make sure that that works for everybody. We want to make sure we get everybody's vote counted. Again, this is community criteria. All right, we have everyone that voted, so that is, it puts us in yellow, it looks like. Okay, next area would be building absenteeism, and Holly's going to walk us through that one.
So for building absenteeism, we look at the absenteeism rate across our buildings. And this last go round, as we look at building absenteeism numbers, one of the things to keep in mind is that we were out of school the last 2 weeks. So the data window that we're looking at began December 7th and ended December 18th. And that we don't have daily student absenteeism data for the last 2 weeks since we have been on break. When we look at this last time window, though, in comparison to last year, we have 4 schools in red, 4 in orange, and 3 in yellow. Our red schools are Derby North Middle, Derby Middle, Oaklawn, and Cooper. Our yellow schools are Park Hill, Swaney, Wyantier, and the high school. And our yellow schools are Derby Hills, El Paso, and Tanglewood. And so when we look at that, we're kind of just right there, almost, in the middle still, if we consider the last 2 weeks. But again, remembering that really the last 2 weeks we were not in school, so that information is skewed just a little bit. And then along with building absenteeism data, we also look at staff absenteeism data, which I believe Becky has briefly brought up before.
Yes, I can speak to that quickly. Those documents are also linked up there on that gating spreadsheet. With staff attendance, we looked at that same window when students and staff were attending school. So December 7th through December 18th was the window that we were looking at. We are very close to at or above 90% present in all of our buildings for that window of time. We're also in line with our baseline when we look at that historical data. We have a couple of buildings, in particular Swaney, Tanglewood, Oaklawn, and Derby North, that are slightly under their historical baseline percentage. Yet again, those schools are still very close to 90% present with their staff. So that's where we are with staff absenteeism for the weeks of December 7th through December 18th. And again, we do have staff that are working over the break whose attendance we track, but it's a large portion of our staff is not working over the break. So we thought it was more relevant and applicable to look at those same weeks that we were looking at with students, so that we would have comparable data to look at.
Okay, questions on absenteeism? Again, a little interesting time frame since that was the beginning, and then now we've been on break somewhat, and for kids with any of that absenteeism, how that falls with coming back. But if you have any questions, we'll try to get those answered. Okay. If not, we'll pull up.
I've got one question.
Sure.
As far as the individual schools and how they're labeled on there, is that just kind of for informational purposes for those first 2 weeks in December, or are we trying to figure out what each school should be, or what's the guidance on how we handle individual schools, or are we just voting on one color for everything?
Holly, you got that with the numbers over the side?
Yep, so with the numbers to the side, that's for informational purposes. We're voting on one number for everything. And then if further discussion is needed for individual schools, we would take that on a case-by-case basis once we've gotten an overall rating.
Yep. She worked on color coding and based on, there is a very small disclaimer, so we can see over there, it is December 7th through the 18th, tracking students when they were in school. For reference, if that helps when you look at absenteeism, like we're out these 2 weeks, but if you start looking at student numbers across the board, that's where probably Nikki, to pull back up, you say how many kids would be absent, you know what I mean, regarding that time. That would probably fall back to how many cases we're looking at, which we reviewed, I think, earlier, which is a little harder because they're not in school again those 2 weeks. So let me give an example would be is if you looked at right now, and I don't want to just, we'll take a couple schools, randomly. I'll take DMS. If you said right now, how many students would be absent potentially? Again, if you're remote, you know what I mean? If they felt well enough, but how many would be absent due to either quarantine or positive DMS? Would we have how many?
We have one student to date right now that is out on a positive at DMS.
Okay. So each school, if you're looking at those, you would say how many people would be absent. It's a little harder. So you're looking those 2 weeks. If you go back to the data too, during those 2 weeks, you have to look that first week and second, even for staff, some of that was higher numbers than we had seen. And then now we're starting to trend down. Does that answer your question?
Yeah. So just for clarification, so if there's a student that's gotten COVID over the break, are we notified through the county as long as they're tested? Is that correct?
Correct.
Okay. So generally speaking, those numbers are relatively low, the number of students that have it right now.
Correct.
Okay. Thank you.
So then I guess my question would be, when you were looking at these we're looking at these schools that are either red, orange, or yellow, is how many of them, we know that the numbers are low on positives. So are they absent because they're just not showing up for school since we're remote? Is that what goes into some of the absentee numbers?
Let building principals chime in, or parents. We have parents on the line here too, what you've seen or staff, teachers. What are you seeing, or what did you see during those 2 weeks?
I definitely think there's an element of, kids not attending for reasons other than illness. So, and I think when looking at attendance data right now, there's a lot of context that has to go into this, and it's really hard to know which way it cuts. So, for me, the attendance is something that I think is important to keep our eye on. But given that we've been out for 2 weeks now also, it's certainly not going to be the overwhelming determining thing in determining, what I think about the ultimate solution.
I would agree with Clint on various aspects of that. I have certain families who just are refusing to do remote. Very few, but lots of them have to do with absences other than being ill. And over the 3 weeks that we were remote, our attendance did go back up significantly over the 3 weeks due to teachers communicating with myself and the social worker and then making calls, the district team making calls to remote families and so forth. So we did see an increase of attendance throughout in the first couple of days. At various different schools, there were some technology issues, and once those flattened out, attendance did improve in those buildings as well. But I would say that the majority of our absences were not because of illness. But I will say to commend our parents that if there was an illness, or they were traveling or whatnot, that they did a very good job of communicating that with the schools and letting us know that they were ill, whether it was COVID related or not. So thank you to the families for making sure they stayed on top of that, even though they weren't coming face to face.
So back to your question, I think that Mr. Watkins may have asked, when you look at it, you had the 2 weeks, you had the data. If you look at right now, the 2 weeks, I think it goes back to those comments. If you had kids and they were, whether online or whatever, when you look at how many kids would be ill, do you want to say, where does that place us? You know what I mean? Are you looking more at a green, yellow, orange, or red, on that? We're at a little tricky one with this break piece and being 2 weeks, which is that 14 days. Okay, any other discussions or questions on that? All right, if not, she'll pull up the polling piece, take a look at it. All right, looks like we have everyone. Puts us in yellow. Okay. The last one we'll take a look at is hospital information. And Nikki, I think you'll talk a little bit about that, and if our physicians have anything to add in. And I appreciate I think Amy also did some legwork today just to get some additional information, because there's lots of different sources of information. We want to make sure we're providing you the latest information to make decisions. So Nikki?
Yep. So linked on that information sheet that was sent out, there's the link to the Sedgwick County dashboard, and then also some KDHE information for South Central. And on the dashboard, I'm going to let Amy talk about this here in just a second to give a very brief highlight of why these are a little bit different. On the Sedgwick County dashboard, it shows that we have 0 ICU beds available. On the South Central dashboard, it shows that we have 10% of ICU beds available. And I know, and I'm gonna let Amy talk about this, but I know the Sedgwick County dashboard only takes our 2 biggest hospital information. So that's where some of that's getting a little bit different, but I will let Amy give a little brief update so you guys understand, because I know there's been a lot of questions about the differences with all the hospital numbers. So go ahead, Amy.
Just to keep this brief, we did find about 3 different data points for this. We could look at Sedgwick County, or we could look at the South Central region, which covers about 19 different counties. The pieces of data were different. One was extremely high as far as ICU bed availability. And when I looked further into those dates and looked into the numbers, only 19 hospitals had reported out of all of the counties in the region. And so the numbers that were being considered for the beds and the data that went into that was incredibly low. And so they just didn't have a large data set for it. And I did contact the health department just to kind of get some clarification. And the two regional pieces of data actually pull from different sources. They came from 2 different databases, and the hospitals inputted their information into 2 different logs. And so that's why we kind of had some differing numbers. Do you feel like I answered the question well on that, Nikki? Okay.
The other piece that would be important, I will mention, they do report out, meaning KDHE, every Tuesday, and those are public via YouTube. So people that are watching, or those of you on there, I know we shared that with the district leadership team, can watch it. They report out on numbers. They are using the 10% number as of yesterday. Tuesday was the date. They also break it down, and they thought that's important to note too, that not every ICU bed is for a COVID patient. So non-COVID patients, they reported there was 154 of them, 55%. COVID patients were 98 of the beds, 35%. And then available ICU beds that they said were 29, which was 10%. So that's the complete breakdown and picture of it. And if our doctors have anything else they wish to add, that's the data we have.
So I talked to my brother last night, who goes to all the hospitals in Sedgwick County. And he said that the hospitals, although there may be some open beds, there's no staff to cover those patients. So even though they may be reporting that they have 10% capacity, they're actually full. So you can take that for what it's worth.
Okay. Thank you for that information. Any other questions or comments? All right, with that being said, we will pull up the polling information for the hospital. All right, the majority puts us in orange on that one. All right, so when we look at the chart, just to recap, and those people that have been joining in, we do have, it looks like orange for gating criteria considerations, community trend, community criteria, building absenteeism in yellow, and then we have hospital in orange. Before we get ready to vote overall with where we're placing, whether it's green, yellow, orange, or red, with how we would operate, where that puts us, do we have any other feedback, questions, discussions, any data that's needed to make that determination? Any feedback from our either medical professionals or support, principals, board members? Okay, if not, oh, go ahead.
I'd like to hear from the doctors just what they're seeing on the ground, what they're seeing in their offices overall.
I can speak to that. I will say that in the week before Christmas, if anybody had any symptom, it was COVID. Whether they thought it was sinus allergies, fatigue, a headache, it seemed like it was coming in right and left. Even people there, presumably for wellness, you know, felt a little tired. It was COVID. It's really prevalent. I would say that if the numbers are low, it may be that some people are just presuming they have it and don't get tested and don't say anything since they don't have to go to school anyway. And that might be part of it. But I would say on the last 2 days before Christmas that I was in the office, I saw several COVID cases.
I would say I agree with Lorraine. Right before Christmas, there was quite a few that, you know, were coming in sick. This week, it seems like it's been a lot less. Overall, to me, it seems like it's been mostly the adults that have been getting it, not really kids. I really haven't seen very many sick kids. The good thing is flu has been almost non-existent this year. So talking about the hospitals and stuff being full, every year in the past, it's always been full of flu. So we've never had hospital beds at this time of the year anyway. So really, it's pretty stable. So overall, I think, the numbers look good. Students, where the numbers are at least on what's positive. We can expect if we go back to school, the numbers are going to go up. That's going to happen. But, when you've got these good of numbers, I think, we have to send the kids back. If you look at all the data from all the feds in the state now, everything says kids should be in school. What we have to worry about is our teachers. So as long as we've got staff that can cover them and they keep doing all that we've done, I think we're safe sending them back to school.
And Marty, are you saying that like EC through 12, EC through 5? How are you?
Definitely EC through 5. I mean, I agree with the board 100% on that they should be pretty much in school, 100% unless you don't have staff for it. The middle school and high school, personally, I think, if you look at the numbers and the statistics of everything, they could all be in school too, but they tend to spread it a little bit more than what the little kids do, and can tolerate it a little better, being remote. But overall, from what I've seen from the mental health and everything, I really think, K through 12 should all be in school unless we have some reason, that there's not enough staff for it. The other great thing that's going on right now is the vaccines. They have come out. A lot of the healthcare people have got it this week. It's going a lot faster. I'm hoping and praying that teachers will be high on that list to come out within the next month to get it. I don't know how soon that'll be, but I'm hoping you guys can get it, just as fast as what we got it. And then, then we won't have as much, debate over, staff as to what's going on with that. But in the meantime, where these numbers are, we've shown through the fall that we can do it. And, these numbers are better than when we had them in school before. So I'm all for leaving them in now.
Hey, any other questions? If not, any other questions on this? We will have a chance to talk about, we're going to go by each level, elementary, middle school, and high school later. Right now, we're looking at, again, gating criteria based on, we had an orange, we had 3 yellows, and then another orange. So do we place us in yellow or orange is what or green or red? So we have yellow, red, orange, yellow, or green for the overall chart is the next step. So Latona's going to pull that up. We're going to go ahead and vote. This places the overall placement.
Can you say one more time where those fell for each of the areas?
I can. Gating criteria consideration fell in orange. Community trend was yellow. Community criteria was yellow. Building absenteeism was yellow. And then hospital was orange based on the votes.
Thank you.
Sure.
Heather, this is Andy. Just one clarification question. If we are in orange, middle school and high school would have to be in hybrid, is that right?
That is correct.
If we're in person. Okay. If we're
middle school and high school in orange would be hybrid or remote.
Or remote. Okay. I just wanted to clarify that for everybody. Thank you.
We'll give a few more minutes. We have another vote to come in. Okay, the votes are in and we are being placed in based on the votes in yellow. Okay. All right. With that next piece, we are going to go in the following order for any other additional discussion would be as we're going to start with elementary school. And definitely want to hear from the group if you have anything else to add, any data questions on that. And then we would vote whether for elementary, either in person or hybrid are the two methods. Any other discussion? Feedback from anyone, committee members or principals on this one? And then
Sure.
Oh, I think I lost my hosting ability, but if we can mute the people that are not talking, because I think we're getting some feedback, at least on my end.
Okay, Heather, I would like to just relay a few comments and concerns. I know most of which has been shared with the gating committee, but in case somebody had missed the several emails that I sent, but the biggest is because if following yellow, that leaves us to be an in-person or hybrid. I know we still have some positive cases and things, but I would strongly voice on behalf of the administrative team for the elementary level that hybrid is not considered because the fear that we have, one, the purpose of hybrid is to reduce our cohort sizes, and we cannot do that unless we're in option one. But then that leaves half of the classes that are home with no direct instruction from teachers on 1 day a week, other than a live check-in at the beginning of the day and the end of the day. And the scheduling piece of that for the elementary levels with specials teachers and specialists, and the missing of interventions that would take place if we were in a hybrid model. So on behalf of the elementary principals, Yvonne can chime in on this as well, but being that we are in yellow and our options are to be hybrid or in person, our principal team would highly recommend that we be in person due to the lack of instruction time that some of our students would get 1 day a week, and a variety of other reasons there. But
okay, thank you for that feedback. Any other comments or feedback?
I wanted to chime in, and I wholeheartedly agree with Shannon. The benefits and the risks for hybrid do not really pay off, and if looking at hybrid or in person is definitely, I think, the way to go and to get those kids back to school. We'll have with hybrid, we'll still be exposing people, but I do feel that the in-person would be the place to go with that.
Okay.
in that transition for our staffs. They're all very, very well versed in teaching in person, and throwing the complexity of hybrid, I think would cause unneeded stress for our teachers as well as our families due to start and stop times being adjusted at the elementary level should we be in hybrid. And I don't know that that would alleviate anything for families or teachers.
Okay, thank you for that. All right, if not any other comments, then we will go ahead and open the polling. The choices again on this one are either in person or hybrid. This is elementary. That may have been one of the first times we have 100%, everybody, 100%. So we will be operating, those watching elementary schools will be in person. Okay, moving on to middle school. Any feedback and comments here from the group and our principals? If you have feedback from middle school.
Well, I would just say that I think in talking to my staff before break and walking through what hybrid might look like to prepare them, I think we have a lot of concerns about the logistics of trying to pull off hybrid coming out of a break and not being in front of kids to explain it to them ahead of time. So I think looking at the data, ordinarily I would be advocating for hybrid in this situation, but given the concerns about trying to implement hybrid coming, on the fly cold, that would lead me probably more towards in person at this time. I do expect that we're going to have a lot of quarantines. I expect that we don't have Christmas data, post-Christmas results in the data set, and so while I know things are looking better now, I'm not optimistic that they're going to continue to improve. And so maybe that does create a little bit of a window where we can get in person right now. And I've been a proponent, I think, of hybrid the whole time, but for this situation, I think asking people to pull off hybrid right now might be a little too much.
Thank you for the feedback. Any additional?
And I have some similar concerns to Clint. I think it would probably take us 2 weeks to get hybrid rocking and rolling, and then it'd be time for another meeting. I am worried about staff and the quarantines. And before we left, we had that same concern with so many staff gone. But with the concerns about trying to go to hybrid out of a break, I agree with that.
Any other questions, comments? Thank you for those. If not, then we're going to pull up the polling for this is for middle school. The options on middle school again are in person or hybrid. Okay, 92% in favor with middle school. So we will be in person to start out with at middle school. All right, now moving on to high school. Any feedback, comments on high school before we take a vote?
I think we're kind of in the same boat. Most teachers that when we surveyed the staff, pretty much everybody agreed it should either be in person or remote, that hybrid was really our last resort. And I think the points that Clint and Jeff make about coming off of a break and going into hybrid would be pretty chaotic, even at the high school level, because we just haven't prepared the kids for it. So I think for teacher sanity, in person, if we can't be remote, in person is going to be our best option.
Okay, thank you for that. Other comments?
I was waiting on the other high school principal. Oh, I guess there aren't. So, facts about the hybrid. The point, in my opinion, the hybrid is to lessen the numbers in the building, provide more opportunity to socially distance. In the high school schedule, that doesn't necessarily guarantee. Not every class is the same. So we could go hybrid, but still one class might have still that day everybody in attendance. So the hybrid would be very difficult on folks. I have all the faith in the world in my staff that they could do it very, very well. But I want the kids here. So.
Okay. Any other comments? All right, if not, we're going to pull up the polling for this is high school. Choices are in person or hybrid. Okay, 96% in favor. So we will be in person at the high school level. So across the board, in person starting back January 4th. This point, we will also take a look at our safety, security, logistics plan. We have a draft. We'll have some discussion, see if we need to make any changes to this safety, security, logistics plan, and then take a vote. So we're going to pull it up and have discussion first. So Latona will pull that up.
Heather, while we're pulling that up, can I ask a question of Becky?
Of course.
Becky, and now that we've decided we're going to be in person across the board, and I understand that's only for, you know, to see what happens, and I do agree that kids need to be back in school and be with their peers. My question is, are we sitting okay if we come back and all of a sudden have a huge influx of quarantines or a huge influx of positive people, that we have enough people to cover classes? Not only teachers, but other staff members as well.
Sure. I don't know if there's a way to predict exactly what is going to happen when you talk about a huge influx or a lot of absences. It's difficult to predict where those are going to be, when they're going to be. I think that's where we look at our data that we're continuously tracking, and we keep an eye on those pockets where we're seeing difficulties with coverage. I do think that we're set up we have all of our floating sub positions filled now. So they have the technology and the tools that they need. They have the training that they need, and we have all of those people hired and in place and ready to help support. I would defer to our principals on that, but the feedback I've heard so far is that that's taken it's a huge relief to know that that is there when there's a sudden unexpected absence or a need for coverage. I also think that our teachers are very capable of working remotely, even when the students are in person, as long as they're feeling well. You know, as long as they're not ill, if they're in a quarantine as a close contact, we've gotten very good and very creative about finding ways to provide supervision for students or alternative coverages in the building where the teachers can still provide that high quality instruction for the students that they've built relationships with. So I do think that we have supports in place and those kinds of things to guarantee that we're going to be able to cover everything if there's a mass absence in a particular building. I think that's where we look at those buildings, just like we did with Cooper Elementary earlier this fall, where we were seeing that there was spread happening within the building and we were having serious concerns regarding staffing and coverage. So I think we would continue to keep a very close eye on that and continue tracking that, and then keep working with our buildings and our teams on the supports that they need to ensure that our students are learning and are safe regarding supervision and instruction.
Okay, very good. I mean, I'm not asking for a guarantee. I know there's no guarantees. If 2020 has shown us anything, it's that there's no guarantees about anything in life. So, but I do have concerns that if we start having problems with our staff, that we have ways to cover those. And I like you said, working from home, that's fine as long as they're not ill. I do not want to have somebody at home that's working from home because we are short staffed, but they have COVID. That is not at all how we need to treat our staff. So
I agree.
Ask a question about the subs. do we have a way to distinguish whether a job is filled by a substitute versus staff? Is that, or does it just show that it's been filled?
I can see exactly who filled it when, and since we've been on break, I haven't been looking at it daily, but prior to going on break, I was looking at it daily, the evening before and the morning of, and I can see exactly who's filled which position. So
I just know there's been concerns in buildings about staff having to cover. So I just wanted to make sure that we're kind of keeping an eye on that as well, because that's a concern too, when staff have to cover on their plan. That's hard on everybody.
Mm-hmm. Yep, and we want to make sure that we're in line with the master agreement on that too, that they're receiving the overload pay or the planning time substitution pay for that, and that it is something that they are agreeing to. And I know that there's pressure to agree to it when you're supporting your colleagues, and it's difficult to say no when you see students in need. But I agree with you. We definitely want to keep a close pulse on that and how people are feeling with that, so that we're not having that burnout and that high level of stress among our staff who are feeling that pressure to cover for each other. But to answer your first question, yes, we can track that. And I think that ongoing communication at the building level is going to be important with that as well.
Just a few comments on that. With substitutes, yes, we'll keep a close eye on it. Will we have at some point issues with covering? Look at our principals on here. Definitely. I mean, I don't want anyone to think we're not going to have trouble. We will have trouble covering at some point and have to figure out. But that is nothing new from prior to COVID. We had that, and I think each building can identify there were times that happened, and then we had to figure some things out. We all share a similar substitute pool in the area. So also keep it in mind as we start bringing people back, other school districts start bringing people back, that also takes a toll on it. We're going to have to be very mindful and just have good communication and working with this and again, that's where that staffing piece, if we're not able to staff for a duration of time and we start seeing cases, then that could change the status of something. So just to mention that, because I don't want people to be watching and be like, well, they had trouble covering, and we will have trouble covering at some point. It will happen. Principals know that. You guys and teachers know it, that's on the call, that happens. But I think right now, we have a nice pool. We have set up and done some things proactively in the district that came from recommendations from that Return to Learn committee. We have hired substitute permanent people at each building, which I think principals could attest that has helped, and that availability of having somebody there. Okay, just lots of info on substitutes. All right, with that being said, safety, security, logistics plan. I think we're ready to take a look at that. All right, with that, again, these aren't set in stone. We're just throwing out a starting place. We talk about mask being out. We're still at a high level is what's being proposed. Temperature check, we would still keep, at this point, staff temperature checks, but students not having temperature checks, putting that at the moderate level since we'd be operating then in yellow. High level still saying that importance of the hand washing, sanitation, doing that piece of it. Visitors and then transportation moving down to a moderate level. So visitors would be allowed with administrator approval that they could come in. So if there was a meeting that needed to be held or something like that, they could approve somebody coming in to do that. And then transportation, again, not doing temperature checks, but loading front to back is required. Any discussions, questions, different considerations that you would like to see on this before we would vote?
Hi, this is Joel Addis. I would just like to say I certainly don't think these should be lessened at all, given that we're going back in person across the board.
So at this point, you want to go back to students being temperature checked district-wide?
No, that's not what I'm saying at all. Okay. What I'm saying is that what's presented, I don't believe should be lightened.
Okay, so leaving it exactly how we have it.
Yeah, I'm not advocating for temperature checks again.
Okay, so leave temperature checks here and visitor transportation where they're at.
Yes.
On temperature checks, it says staff and students may be required for temperature checks.
Right.
I would like to leave it as that and not say that staff must have their temperature checked when they enter the building.
So at this point, what we've done on that, when we've operated before under it, we've done it as a district. So for instance, right now we've said students aren't temperature checked and staff are. So if we're wanting to say no temperature, it'd be district wide that we're not doing staff temperature checks.
Do we want to discuss that? I just
sure
wondered if anybody wanted to discuss that.
I like the idea of visitors still being temperature checked. Not that I think the temperature check really does a whole lot, but I think Jeff said it in a previous meeting that there's just kind of this air of, yes, we're taking safety seriously, and it just kind of mentally helps a little bit. As far as staff, staff are doing it anyway. It's not a big deal, but yeah, I definitely wouldn't lessen it.
I would agree as well. I feel like with having this staff, although it doesn't, we don't send them home because that, it's a self-check, but I think it makes them very aware. If I'm sick, I should not be at school. Just kind of keeps reminding them, because teachers want to come in and they want to be there for their kids, but it's just that reminder to them. If they're sick, they should be home.
Okay, other thoughts and comments on that? So what I'm hearing, if we leave it right there, visitors would be, I just want to get clear where the group's thoughts are. Students would not. What was staff? Yes or no?
Staff, yes.
See head shaking. So staff, yes, at this point still. And then to Allison's point, it sounds like in the future, maybe if things are running well, to come back and revisit it. Okay. All right, so that's the understanding there. Staff would be, students wouldn't be, and then visitors would be. Okay. Any other changes to the chart or clarification? All right, if not, the final polling for today, Latona is going to pull up the safety logistics chart. Do we agree with currently how it is marked and the understanding that how we would operate under the temperature check piece? Okay, 96%. Very good. All right, with that being said, and that the last one, I want to thank you guys for today, your time and your input. Appreciate everybody joining in. Since we are going back full in person, I think this is a great reminder for this committee and also everyone else that's tuning in to help things run smoothly, to help us be able to keep our kids in person. If people have symptoms, to please do not send kids to school. If staff are not feeling well, to not come to school. We will work to get coverage, whatever's applicable would be important, so we can try to run as long as we can. So with that being said, our next meeting will be January 13th at 1 p.m. And I hope everybody has a good rest of your week. And then we welcome in 2021. We'll see everybody. Have a good one. Thank you.
Thank you.